and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top headlines. Honey trap, Dabur clarifies on presence of cancer-causing chemicals in product, says report baseless and motivated. Terming the claim as motivated and baseless, Dabur India Limited has junked the report about the presence of cancer-causing substance in its honey and clarified that every batch of honey that the company produces complies with FSSAI standards. The Dabur Honey and Chyawanprash makers' revenue in April and June rose nearly 11% to 31.30 billion rupees, led largely by growth in its consumer care business. Honey products contribute 6 to 7% to Dabur's revenues in India. However, the stocks of Dabur hit an 8-week low on Thursday after reports claimed the presence of carcinogenic materials in its honey product. The controversy erupted after a recent Zee News report claimed that high concentration of carcinogenic material was allegedly found in the popular brand Dabur Honey. The samples of honey were tested at the Center for Analysis and Learning in Livestock and Food at the National Dairy Development Board in Gujarat. However, Ankush Jain, CFO Dabur India, said that we heard this news and we would want to say that we stand by the purity of Dabur Honey. Every batch of Dabur Honey which is produced in any of the factories complies with all the FSSAI standards, and both at the time of the receipt of the raw material and also post refinerization or packaging of the final product. This seems to be a very motivated report. A viral WhatsApp message asking to register on NMC portals sending doctors on a frenzy. A message asking doctors to apply for their unique identification number on the NMC portal by 10th of August that has gone viral on WhatsApp has indeed created a frenzy amongst medical practitioners. Doctors are worried over a recent message which is being circulated on social media platforms asking doctors to apply for their unique identification number on the NMC portal. While this message has created panic among medical practitioners, a member of the NMC has informed Medical Dialogues that the deadline mentioned in the message of the deadline is fake. This situation of confusion and uncertainty is linked to the registration of medical practitioners and license to practice medical regulations which were published in the Gazette of India on 10th of May 2023. For the first time, there is a pill for postpartum depression. The FDA has granted approval for the first ever pill to treat postpartum depression, marking a significant milestone in addressing this debilitating condition that affects approximately 500,000 women annually in the US. Clinical trials have shown that the pill works rapidly, with depression symptoms beginning to improve in as little as 3 days, in contrast to traditional antidepressants which can take up to 2 weeks or more to take effect. Another advantage is that this new pill only needs to be taken for a short duration of 2 weeks as opposed to months, which may lead to increased acceptance of treatment among patients, according to maternal mental health experts. However, the most noteworthy aspect of this approval is not just the characteristics of the drug itself, but the fact that it is specifically designated for postpartum depression. The hope is that the availability of this dedicated medication will encourage more women to seek help for postpartum depression and prompt obstetricians and family doctors to be more vigilant in screening for symptoms as well as suggesting counseling or treatment options to affected individuals. This development is expected to increase recognition and treatment of postpartum depression, offering new possibilities for women struggling with this condition. Despite new CBME rules, the next dilemma continues. With the NMC recently releasing its CBME regulations governing the entire functioning of MBBS education in India, there were hopes that there would be clarity on the future of the national exit test in the coming few years. However, the guidelines have silently ignored to address the question of since when next will be applicable, adding to the dilemma of thousands of students who are currently pursuing their MBBS. The Competency-Based Medical Education Guidelines 2023, which are effective from 1st of August, talk about various aspects of MBBS admission. Regarding the students who are going to join the MBBS course this year, the regulations make it clear that they will give their next exam in 2028. The new CBME regulations mentions about next that according to the academic calendar for the MBBS batch of 2023 and 24, which has been published by the NMC in the final CBME regulations, next step 1 will be held in February 2028 and Step 2 exam will be held in February 2029. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.